going to begin now, and when the seventh person comes, we'll be in a position to vote. So the Senate Committee on Health, Education, Labor, and Pensions is coming to order. Today, we will be holding a vote to authorize an investigation into the bankruptcy of Steward Healthcare and to subpoena its CEO. And let me begin by thanking Ranking Member Cassidy for his cooperation on this important issue. And let me thank Senator Markey of Massachusetts for his outstanding leadership on this matter, for holding the first hearing on the subject in the subcommittee that he chairs, and for bringing this issue to our attention. Ed, thanks very much. In my view, and I think the view of most Americans, we have a healthcare system today that is broken, it is dysfunctional, it is wildly expensive, and in many cases it is extremely cruel. It is a system that is designed not to make patients well, but to make insurance companies and drug companies and other people who make money off of the system extremely wealthy. And in my view, there could not be a clearer example of that than private equity executives on Wall Street making huge amounts of money by taking over hospitals throughout our country, loading them up with debt, and stripping their assets. Perhaps more than anyone else in America, a dubious distinction, no doubt, Ralph De La Torre, the CEO of Steward Healthcare, epitomizes the type of outrageous corporate greed that is permeating throughout our for-profit healthcare system. Working with private equity executives, Dr. De La Torre became obscenely wealthy by loading up hospitals from Massachusetts to Arizona with billions of dollars in debt and selling the land underneath these hospitals to real estate executives who charge unsustainably high rent. As a result of Dr. De La Torre's elaborate Ponzi scheme, Steward Healthcare and the more than 30 hospitals it owns in 8 states were forced to declare bankruptcy with some $9 billion in debt. And let us be clear, while Steward Healthcare declared bankruptcy just a few months ago, its severe financial problems have been going on for more than a decade. And here are just a few examples. In 2014, Steward shut down the Quincy Medical Center in Massachusetts, laying off 700 healthcare workers with the exception of its emergency room, which it shut down 6 years later. In 2018, Steward shut down the Northside Regional Medical Center in Youngstown, Ohio, laying off 468 healthcare workers and closing the only labor and delivery unit in that city for pregnant women and their babies. In 2019, Steward shut down St. Luke's Medical Center in Phoenix, Arizona, laying off 655 healthcare workers. Last year, Steward shut down the Texas Vista Medical Center in San Antonio, laying off 827 healthcare workers. This year, Steward shut down the New England Sinai Hospital in Massachusetts and a medical center in Southeast Texas. It also temporarily shut down Norwood Hospital in Massachusetts, but then stopped paying the construction workers who are working on the project, making it unlikely that this hospital will ever reopen. Steward has shut down several pediatric wards in Massachusetts and Texas, and closed neonatal units and eliminated maternity services at a hospital in Florida. Its medical center in Louisiana is at risk of closure after being cited on multiple occasions for putting patients in immediate jeopardy from regulators. It has failed to reopen hospitals in Utah, Texas, and Florida, even though Steward received hundreds of millions of dollars from private equity and real estate firms to serve patients in those states. And on it goes. We know that Steward has gone bankrupt. We know that several of its hospitals have already been forced to close their doors because they ran out of money. We know that communities and the people in those communities that depended on these hospitals are uncertain about what this bankruptcy means for their future. It is a big deal when a hospital in your community shuts down. But here is what is particularly obscene about this whole complicated situation. In the midst of all of the crises that Stewart's policies have had on hospitals and communities all over this country, Dr. Delatorre has been doing phenomenally well financially. Hospitals shut down, workers laid off, patients suffer. Dr. Delatorre has been doing extraordinarily well financially. The hospitals he managed closed down, and he makes huge sums of money. While Stewart was busy shutting down hospitals all over America, Dr. Delatorre received a $100 million payday that he used to purchase a $40 million yacht. There is Dr. Delatorre's lovely yacht. While Stewart's hospitals were laying off healthcare workers, Dr. Delatorre received some $16 million a year in compensation, enough to afford this $15 million custom-made luxury fishing boat. Not quite sure how you pay $15 million for a fishing boat, but while they were shutting down hospitals, that's what he managed to do. Now, while Stewart-owned hospitals could not afford to pay for life-saving supplies, it had enough money to purchase a $62 million private jet. Hospitals shut down, workers laid off, patients without care, private jet. But apparently, for Ms. Dr. Delatorre, one private jet is not quite enough. So what did his company do? Because how can you get by in this day and age with one private jet? You know, it's tough. So what his company did is bought a backup jet worth an estimated $33 million just in case the first jet broke down. It's kind of normal medical procedure. And it is almost hard to make this stuff up. The greed that we are seeing here is really quite extraordinary. Now, how many of Stewart's hospitals could have been prevented from shutting down? How many lives could have been saved? How many healthcare workers would still have their jobs if Dr. Delatorre spent $150 million on high-quality healthcare instead of his yacht, 2 private jets, and a luxury fishing boat? We are here this morning because time and time again, this is an important point to make, time and time again, Senator Cassidy, Senator Markey, and I have invited Dr. Delatorre to come before Congress, to come before this committee, to testify about the financial mismanagement at Stewart. And time again, he has arrogantly refused. Well, today we are saying enough is enough. It is time for Dr. Delatorre to get off of his yacht and to explain to Congress the financial chicanery which made him extremely wealthy while the hospitals he managed went bankrupt. It is time for Congress to hold Dr. Delatorre accountable for his extreme greed. And let us also be clear, this is not just about Dr. Delatorre. Cerebus, the private equity firm he partnered with, made an $800 million profit from its investments in Stewart Healthcare. Where did that money go? Other than Dr. Delatorre, who else benefited financially from these financial schemes? Those are just some of the questions we will be asking. Further, this is not just about Stewart Healthcare. In America today, rather alarmingly, private equity firms own 460 hospitals, 22% of all for-profit hospitals in our country. How many of these hospitals are being loaded up with debt in order to make a handful of executives at private equity firms even wealthier? How many of these hospitals are in danger of being shut down? How many patients are at risk because these hospitals may no longer afford to purchase life-saving medical equipment? These are questions that the American people deserve to know, and these are questions that we must be asking. Senator Cassidy, you are recognized for an opening statement.